And then you could also push towards the ear canal. Let's take a look at the key points for the tragus, the external side as well as the internal side. The next section we're going to consider is the inferior concha. First, let's define the area. It's the lower cavity representing the thoracic part of the torso. We're going to start this section just on the inside of the antitragus and slide our probe up to the helix CRUS, making passes in this fashion. After you sweep in this direction, you could also sweep across towards the ear canal. Now let's take a look at some of the key points in the inferior concha. Our next section is going to be around the helix CRUS. So let's first define the area. Here's your helix coming around here, and the helix CRUS is this section right in the cavity of the ear. And we're going to be going around the helix CRUS, which is like a U shape. The helix CRUS is associated with the digestive tract. Starting here, and we're going to work our way around. Let's take a look at the key structures around the helix CRUS. Our next section is the superior concha. First, let's define the area. The superior concha is in the cavity above the helix CRUS, right here. To work the superior concha, we're going to start at the helix CRUS and sweep up in this direction. After we make passes in this direction, we're going to work across, like so. Now, let's take a look at the key points in the superior concha. next section is the triangular fossa. First, let's define the area. Shaped like a triangle, just above the cavity of the ear, in this section, right here. To work the triangular fossa, we'll start at this corner of the triangle and work our way towards the head. Now let's take a look at the key structures at the triangular fossa. Now let's take a look at the antihelix. First, define the area. Starts right here at the notch, close to the antitragus, and comes up to the base of the triangular fossa. This section represents our spine. To work the antihelix, we could start and move in either direction. So starting from this section, we're right at the point of the triangle of the triangular fossa, and we're probing our way down right on the antihelix. Regarding the antihelix, sometimes it's referred to as the body of the antihelix, from the notch up to the base of the triangular fossa. Now let's take a look at the important structures, the key structures of the antihelix. Our next section is the antihelix inferior CRUS. Let's define the area. It's a small section right here, and actually it's a branch off of the antihelix. So as we make our way up the body of the antihelix, we come to the triangular fossa, and the antihelix, the inferior portion, is right at this border of the triangular fossa. In working this area, we can stroke the probe in this direction right on this ridge. To work this area, we're going to start at this corner of the triangular fossa and work right on the ridge towards the head. Now let's take a look at the important structures at the antihelix inferior CRUS. Our next section is the antihelix superior CRUS. First, let's define the area. This really starts here at the base of the triangular fossa and works up through this region up to the helix. It's really, once again, an extension of the antihelix body. So here's the body of the antihelix, and as we come up here, there's a fork in the road. And this section here is the antihelix superior CRUS. To work this area, we could start at the base of the triangular fossa and work our way to the helix. Another direction to work the antihelix superior CRUS is up in this direction, across. There's some great points up just underneath the helix. Let's take a look at the key structures in the antihelix superior CRUS. The next area is the scaphoid fossa. First, let's define the area. It's this depression all the way across here. The borders of the scaphoid fossa, or the helix, around the outside of the ear, and the antihelix. So this big depression right here is a scaphoid fossa. To work the scaphoid fossa, we could start in either direction. Starting at the base here, we could run our probe through the fossa area. Maybe the first pass could be closer to the antihelix and the antihelix superior CRUS. Then we can make another pass right down the middle. Up to the helix. And then finally another pass bordering up right close to the helix. Let's take a look at the key structures of the scaphoid fossa.